Now, scientific paper presentation. I would like to request Dr. Abu Kamran Rahul to present his scientific paper. Please come on the dais and please present your abstract. Time duration is 5 minutes.
Assalamu alaikum. Very good morning. Welcome to my abstract presentation. I am Dr. Abu Kamran Rahul, Department of Internal Medicine, Bangabandhu Sheikh Mujib Medical University. My thesis title was Vitamin B12 status in long-term metformin treated type 2 diabetes mellitus patients. The association between long-term use of metformin and low vitamin B12 in patients with type 2 diabetes mellitus patients has been proven according to FDA guideline. However, the prevalence among metformin-induced vitamin B12 deficiency in type 2 diabetes mellitus patients showed considerable variations among the studies in subcontinents including Bangladesh. The potential of deficiency to cause new onset or pre-existing peripheral neuropathy in type 2 diabetes mellitus patients has been investigated with conflicting results. The objective of this study is to determine the frequency of vitamin B12 deficiency among patients with type 2 diabetes mellitus patients. This cross-sectional analytical study was conducted at the Department of Medicine in Sylhet MAG Osmani Medical College and Hospital. Total 100 patients with type 2 diabetes mellitus were selected according to inclusion and exclusion criteria following informed written consent. They were divided into two groups. Each group contained 50 patients. In group 1, those who are taking metformin for one or more than 1 year, and group 2 included patients who are not taking metformin for at least 1 year. Detailed history, proper clinical examination and relevant investigation were done. After collection of all required data, final analysis was carried out by using the SPS version 22. Among 100 patients of type 2 diabetes mellitus, mean age was around 55 years. They were similar in terms of demographic profile. About 16% of patients of group 1 had vitamin B12 deficiency and only 6% had vitamin B12 deficiency in group 2. The mean serum vitamin B12 was 481.52 picogram per ml in group 1 and 600.85 picogram per ml in group 2. This difference of serum vitamin B12 was statistically significant as the p-value was less than 0.05. Reduced vitamin B12 also found to be positively associated with the duration of metformin intake and presence of neuropathy. So in conclusions, the metformin is associated with decreased level of vitamin B12. So my recommendation is that vitamin B12 should be measured prior to initiation of metformin therapy and later annually in patient of diabetes mellitus who are on long-term metformin therapy for at least 1 year or more than 1 year. Thank you all. Thank you for your patience hearing.